Bonjour and welcome all to the Société Santé en Français webinars. My name is Nathalie Boivin. I'm a knowledge broker officer at the Société Santé en Français, and it's a pleasure to be your host for this webinar entitled The Official Languages Recognition Program, OLRP, and added value for your organization. I would like to begin by acknowledging that the land where I am today is the traditional unceded territory of the Maliseet and Mi'kmaq peoples. This territory is covered by the Treaties of Peace and Friendship, which Maliseet and Mi'kmaq peoples first signed with the British Crown in 1725. I'm grateful to the Maliseet and Mi'kmaq peoples for their hospitality on these unceded land. Société Santé en Français is a national group of 16 provincial, territorial, and regional networks that are committed to improving the health of all Francophones and Acadians living in minority communities in Canada through greater access to quality health care services in their language. Webinar objectives are as follows: improve access to new information, facilitate evidence-based decision-making, and foster interaction between information providers and users. Those webinars are made possible thanks to the financial contribution of Health Canada. A few items of logistics before we go any further. You are all in mute at this time, but we want to hear from you. There are different ways for you to participate and interact with us. During the presentation, you can do so in writing using the chat box or the Q&A box at the bottom of your screen. As well, there will be a few polls. They are anonymous and optional, but we strongly encourage you to participate. During the discussion session, you can raise your hand to verbally ask a question, or you can use the chat box to ask a question. I talked about polls, so let's throw a question at you. Here is the question. It is as follows: what is the status of your efforts to facilitate access to health and social services in official languages within your organization? There's one single choice for you to pick. Is it one or more programs have started the OLRP? One or more programs are enrolled in the OLRP? Or is it that your organization is exploring the possibility of enrolling programs in the OLRP? Or that your organization needs more information about the OLRP? Your organization is not aware of the OLRP? Or is it other? And if that is the case, please use the chat box to specify. So please pick one of the options appearing. Meanwhile, I'll let you know that there are quite a few of you today. We're very happy to have you with us. There are people from Yukon, Manitoba, Ontario, Quebec, Newfoundland and Labrador, New Brunswick, and PEI. So welcome to all. Waiting for the results, I will introduce our two panelists today. The first one is Chantal Galipeau. Chantal is a project manager at Accreditation Canada, responsible for the development and implementation of the Official Languages Recognition Program. Chantal is dedicated to social impact, innovation, and value creation. She is passionate about systemic solutions for equity. During her career, Chantal has worked in multiple technological industries and has demonstrated success leading projects in many areas, including health, education, artificial intelligence, business intelligence, telecommunication, and agricultural technology. Chantal is a devoted mother who enjoys running and participating in team sports. Our second panelist is Geneviève Laferrière. Geneviève is passionate about health equity and quality service delivery for all. With 15 years of experience in this sector, Geneviève's work focuses primarily on knowledge mobilization and establishing the right partnership to support winning conditions for person-centered French language service delivery at the regional, provincial, and national levels. Geneviève is responsible for Equity Link, a national resource for health providers to build linguistic competencies within diverse health systems, bilingual health workforce strategies, and long-term care models for Francophones. Geneviève holds a Bachelor of Commerce degree from the Telfer School Management at University of Ottawa, with a specialization in international management, a project management certificate from La Cité Collégiale, and a change management certificate from CHA Learning. I will stop sharing of my screen, and I see that we cannot show you the results of the poll, but as soon as we get that, we will show them to you. But I will just pass it on now to Chantal Galipeau and Geneviève Laferrière to know more about OLRP. Ladies.
Thank you. Hi, everyone. Welcome. I would like to begin today's meeting by acknowledging that across Canada, we are located on the ancestral and unceded lands of various First Nations, Inuit, and Métis people. While we meet today on a virtual platform and as a large dispersed group, I would like to acknowledge the ancestral and cultural contributions of First Peoples and all multicultural communities. This acknowledgement reaffirms our shared personal commitment to respecting all cultures and improving relationships through enhanced cultural respect, awareness, competence, equity, diversity, inclusion, and collaboration. It should be noted that what we see today in this presentation was made possible through efforts that span many years. The work done by so many different perspectives and voices has been instrumental in developing the next step in reducing barriers to accessing health and social services for official language minority communities. Many thanks to the Société Santé en Français for being a pioneer in this movement and for its continued commitment. It should also be noted that the standard entitled Access to Health and Social Services in the Official Languages, as well as the Official Languages Recognition Program and Equity Link, have been commissioned by Société Santé en Français and funded by the Government of Canada.
Chantal and Geneviève, we do have the answers to the poll. So would you like us to show those answers, the results at this time? Okay.
Yeah, I think that's a great idea.
Let's do it. Let's show the results. So we can see that there's for the majority of you, the answers was other. So we'll look into that in the chat. But besides that, 18% of you, one or more programs have already started the OLRP in your agency. 18%. Your organization needs more info. 18%. And 12%, one or more programs are enrolled in the OLRP, 12%. So we've got quite a variety today. Thank you very much for choosing an answer and letting us know more about you. Thank you.
Thank you so much, Natalie. So before we begin, here is a quick overview of HSO and Accreditation Canada and their roles. Health Standards Organization, also known as HSO, develops evidence-based, internationally recognized health and social service standards, providing a consistent set of criteria and guidelines for quality and safety. Accreditation Canada delivers accreditation, certification, and other assessment programs powered by internationally recognized standards and customized to local needs. Accreditation Canada is an assessment partner of HSO. HSO and Accreditation Canada are both nonprofit organizations headquartered in Ottawa, Canada. I will invite Geneviève Laferrière to speak further on Equity Link.
Thank you, Chantal. So Equity Link is a national online resource site designed to promote equitable access to health and social services in French. Equity Link integrates the criteria of the HSO standard, which Chantal mentioned, by offering a range of resources to support organizations in developing their capacity and complying with the requirements of Accreditation Canada's Official Language Recognition Program, or the OLRP. Together, Equity Link and the OLRP provide concrete strategies and tools to increase access, as well as a tangible measure to monitor the progress of health services in French over time. So it helps guide organizations in their French language services journey, no matter where they start. Back to you, Chantal.
Thank you, Geneviève. So we heard about the unmet needs in health and social service organizations. Literature demonstrates that language barriers in health and social service settings can lead to misdiagnosis, delays in treatment, lack of user satisfaction, complaints, official sanctions, and poor health outcomes. This access challenge is accentuated in vulnerable populations. The problem has also recently been exacerbated by COVID-19 and the resulting health human resource challenges. After listening to needs across Canada, an initiative was started in 2014 where Health Canada, in partnership with Société Santé en Français, funded HSO for the development of a national standard named Access to Health and Social Services in Official Languages, which was published in 2018. Since then, Health Canada and Société Santé en Français have supported the development of this program, which is based on this national standard in the format of a new recognition program to support Canadian organizations in health or social service settings. Today, we are proud to offer this new recognition program to assist with needs of access and language. Linguistic duality has become a part of our national identity and is a source of economic, social, and political benefits for Canadians. Adapting to multiple official languages in Canada plays a role in the improvement of inclusion, diversity, equity, and accessibility. Supporting Canada's linguistic duality through systemic initiatives and tools with measurable outputs helps create new opportunities for linguistic accessibility as a whole, which includes provinces with more than 2 official languages and other types of linguistic accessibility. So what does the potential solution to this problem look like? How do we plan to meet this need? Well, given the fact that the problem is systemic, it would have to be a systemic tool available on a national scale to support health and social service organizations in the continuous improvement of their official language accessibility. And most importantly, this has to be regardless of their current standing in their journey. In order to efficiently increase access to care in the user's preferred or required language, the tool must be clear, accessible, and manageable in a unilingual environment with a reduced capacity or workforce. To date, there have been few nationally coordinated initiatives geared towards official language accessibility, especially an initiative that not only supports but rewards organizations committed to improving this competency. The challenges faced by official language minority communities have highlighted the importance of investing in the right tools, processes, and training that enable quality communication between the people who provide the services and the people who receive them. Hence, the development of a new recognition program built around the national standard for access to health and social services in official languages, adapted to Accreditation Canada's new recognition program framework. The Official Languages Recognition Program empowers organizations to benefit from flexible program application and covers multiple overarching themes, such as communication and language services, clinical research where applicable, governance and leadership, workforce, quality assurance, and measurements for improvement. The framework of the recognition program includes multiple progressive levels, each sporting various thresholds. Recognition is a voluntary process that aims to improve the safety and quality of health and social services for the public. It assesses continuous improvement and targets a specific organizational competency, which in this case is language accessibility. The Official Languages Recognition Program is available to all health or social service organizations, regardless of their experience or previous enrollment in any Accreditation Canada programs. Recognition is a targeted, multi-level quality improvement process that measures and assesses continuous improvement of a specific organizational competency. Through this program, organizations are granted a recognition award. I'll explain the high-level principles of the OLRP. Firstly, let's look at the evidence and rigor behind this program. The OLRP is based on the HSO National Standard for Access to Health and Social Services in Official Languages. It aims to improve both the access and the safety and quality of health, social, and community services for the public in Canada's official languages and is adaptable to other languages. Principles of people-centered care and integrated care are also reflected in the design of this program. The on-site assessment is performed by peer experts. Readiness is also a factor. This is made available to all health and social service organizations, regardless of their maturity level. There are no other eligibility requirements, and there is no intensive preparation required prior to joining Level 1. The new program design enables flexible enrollment. Enrollment is easy, digital, and online. The enrollment uses a decentralized and bottom-up approach, meaning that various programs at each location can choose to enroll at their own pace. The entire organization does not have to join at the same time. The participating programs at each site will work towards this recognition status based on their level progression throughout the program at their own pace. A client can have one or more programs enrolled at a location. To address both the financial investments and level of effort, there are a few unique updates to this program. Level 1 uses 100% digital tools and has a lower time commitment and a lower level of effort. Program enrollment at each site is offered at a low cost. Now I will outline the progressive levels of the OLRP. So the Official Languages Recognition Program is an iterative quality improvement process that enables organizations to better serve their communities and recognizes organizations for their contributions toward providing equitable care for all. This program empowers organizations to leverage evidence-based best practices for language accessibility adaptable to multiple languages. The primary objective of the Official Languages Recognition Program is to increase access to healthcare and social services in the user's preferred or required language. The OLRP is a tangible measure for the increase of official language accessibility in health and social service organizations, supported by excellence criteria for the entire country. The OLRP's vision is to support and award health and social service organizations on their journey to increasing access to care in official languages. And as stated by Raymond Théberge, Canada's Commissioner of Official Languages, to maintain linguistic duality in Canada, we need two key ingredients: respect and recognition. So who are the users or participants of the program? Participants can stem from a wide variety of health and social service organizations, including, but not limited to, governmental health and social service institutions, community services, telehealth services, public and private health and social service organizations, and more. The OLRP is intended for all health and social service organizations in Canada. Organizations and health authorities can enroll one, several, or all of their programs and sites to participate in the OLRP at their own pace. Prior accreditation is not a prerequisite, and the program manager within the participating organization also does not need to be bilingual. Several pilot sites have participated in the testing of the assessment tools that contributed to the development and continuous improvement of these evidence-based tools. These tests spanned multiple provinces and types of services and helped to set the foundation for what we see today in the OLRP. As previously stated, OLRP is a multi-level program. Level 1 is now offered by Accreditation Canada, and Level 2 will be launched at the end of March 2023, which is coming up very soon. But what does each level entail? Let's take a look. Participating organizations begin the Official Languages Recognition Program, OLRP, at Competency Level 1, also titled Discovery. At this level, the organization's first step is to complete a self-assessment using the OLRP assessment tool to identify the strengths of the organization and address areas for improvement. After completing the self-assessment, the organization receives acknowledgement of its participation in the OLRP. I'll take a quick moment to visualize how OLRP Level 1 Discovery was created. First, after a stringent quality assurance process and with the help of a highly experienced technical committee, the HSO National Standard was published. It was later used for the development of an assessment program, which was tested at multiple pilot sites. And now, as a step further in concretizing the progress for official language accessibility and helping organizations continue or begin their learning journey, these tools have been integrated into a digital solution as part of the recognition program framework and made available across Canada. Let's do a quick overview of the resources and features included at Level 1. Discovery includes flexible virtual access, a self-assessment tool, a self-assessment guide, a certificate of participation, and a communications kit. The program also includes bilingual content developed by experts, frequently asked questions and their answers, a bank of links to useful resources, a bilingual glossary, and a clear and simple interface. Starting with the homepage, here is a quick sneak peek of the program's first level, now available to Canadian organizations. The user can switch back and forth between French and English directly within the program's content. Each criteria is prepared for Level 2 decision guidelines using a tag. Here we see a tag stating Step 2. These tags are also represented directly within the self-assessment tool, which helps organizations prepare for their next step in the OLRP by understanding which practices are foundational, transitional, and required for sustainable improvement. There is much more to see, but for now, we will learn more about Level 2. After completing Level 1, the organization then decides whether it wishes to maintain its status at this competency level or continue its progression to Competency Level 2, which includes analyzing the results of the self-assessment, developing a quality improvement practice plan, and participation in an on-site peer review. When the self-assessment and peer review have been completed in accordance with the program award decision guidelines, the organization is awarded the OLRP Foundation's award. I will now invite Geneviève to further introduce Equity Link and explain how this helpful resource site can provide additional support to health and social services organizations throughout their OLRP journey. Over to you, Geneviève.
Thank you, Chantal, and thank you for the overview of the OLRP. So now I will be exploring how Equity Link can support organizations wishing to enroll in the OLRP and also progressing throughout the different levels, as Chantal mentioned. So Equity Link is a free resource site made available through funding by Health Canada, and it is entirely confidential. Not even administrators do not have access to organizations' dashboards or results. It is really meant for managers of health, social, and community service organizations wishing to increase their offer of French language services. It is a guide for them entirely, and it is meant as a support. The proposed approach, strategies, and tools can be adapted to meet the needs of underserved communities, since it is based on a population health management approach. So the goal was really to help organizations who reported that they didn't know where to start when it came to offering French language services, and oftentimes underestimated their current capacity to do so. So how can this website support increased access to French language services? Well, by fostering awareness of issues relevant to equitable access to language services and their impact on people's health outcomes, by providing knowledge on proven practices to address these issues, and supported with the right tools and a network of experts, as well as a community of practice to provide that additional support throughout the journey. So Equity Link is more than just a website. Equity Link also has 4 key pillars: to guide, gather, empower, and sustain. So we guide our users through the various steps to address language barriers and organizational challenges related to French language service delivery. We gather validated, evidence-based advice, strategies, and tools informed by various committees of experts. We empower users by enabling them to assess their current French language service capacity and improve their capacity by following the suggested best practice approach to achieve their individualized goal at their own pace with extra support as needed. And we sustain the offer of French language services by supporting the implementation of proven solutions and using lessons learned to improve health services for all. Next slide, please, Chantal. So Equity Link offers a step-by-step guide called Equity Fundamentals. This guide provides a free opportunity to become familiar with the simplified and OLRP-related criteria, providing relevant guidelines nationwide. After answering 45 questions, Equity Fundamentals tool will support your organization in the development of a personalized French language health services plan based on your current capacity. As mentioned, this process is entirely confidential, as it is meant as a guide for organizations and not an assessment or reporting tool. Next slide, please. So Equity Link is there to support health managers directly. Based on the results from the questions outlined in the previous step, you will access your organization's personalized dashboard. This section allows your organization to always access its baseline data and compare it with current progress from your personalized French language health services plan. Your results will assist you in navigating and consulting relevant resources to modulate your plan to reflect your organization's priorities and available resources. Afterwards, you can manage, edit, and track your plan's progress in real time and have relevant information to measure your capacity building efforts, for which you can gain formal recognition when enrolled in the OLRP. Next slide, please. Equity Link has gathered and is continuously improving its access to key resources to support access to French language services for organizations, educational resources, tool, and a network of experts, as well as a newly formed community of practice, offer ongoing support. Current available resources are Equity Fundamentals, which, as mentioned, is an A to Z guide to plan, implement, and assess French language services, which are linked to our other key resource by topic. So our current topic resources available are the Bilingual Health Workforce Strategy 2.0, which is a modernized version of the Health Human Resources Strategy, or HHR strategy, which some of you may be familiar with, a logic model guide, as well as providing a showcase for the active offer training. Additional resources which will become available by March 2023 are also a guide for policies to support the provision of French language services, as well as a resource to support the implementation of Café de Paris, a project to help increase language capacity within current staff. We also have a team working diligently in the background to improve our user experience in Equity Link over the next 12 to 18 months. Next slide, please. So this is a testimonial from one of our Equity Link users. To give you a little bit of background, Heather is in the Niagara region, located in the Niagara region, which is a partially designated region in Ontario. So in Ontario, designated regions have an obligation to offer French language services, and partially designated regions have some expectations and reporting requirements to the ministry. So this testimonial comes as a direct result from our network of experts who suggested Equity Link to various service providers and gathered their feedback on the impact regarding this tool as an organizational support to improve French language services. So as Heather mentioned, she did really appreciate the tool, downloaded every resources and link. And I think what is important to retain is that it provided her with insight and understanding to help share within her organization, and that afterwards she was able to gain commitment from the organization to capture their clientele's language preference and first language. So off to you, Chantal, for the next overview of how Equity Link and the OLRP work sort of side by side and support each other.
Thank you so much, Geneviève. Let's go over the key differences and linkages between the official language recognition program and Equity Link. So firstly, the OLRP consists of a tangible measure for increased official language accessibility in all health and social service settings, supported by excellence criteria for the entire country. The OLRP also consists of an impartial evaluation of participating organizations and official recognition of their efforts. It also provides educational resources, tools, reports, and recognition awards. I will invite Geneviève to speak to Equity Link.
Thank you, Chantal. So Equity Link offers a free opportunity, as we mentioned, to become familiar with the simplified and related OLRP criteria. It also helps support organizations in their continued capacity building once they've enrolled in the OLRP and are able to gain that formal recognition of their efforts and move on to the next levels. Finally, Equity Link provides educational resources, tools, and a link to a network of experts, as well as a community of practice to provide ongoing support through potential challenges that you might be faced in the implementation process. Back to you, Chantal.
Thank you. And I'll just add to that together, Equity Link and OLRP provide concrete strategies and tools to increase access, as well as tangible measures to monitor this progress over time. As a summary of what was previously shared, the OLRP is intended for all health and social service organizations in Canada, independent of maturity level. Organizations do not need to be enrolled in any other Accreditation Canada program to be eligible. Organizations do not need to join, they do not need to be 100% ready before joining. The program coordinator within the participating organization does not need to be bilingual. The program is also designed to flexibly allow one or multiple programs at each location within an organization to onboard. The power is in your hands to transition more programs by locations at your own pace. The first step, level 1, is 100% digital and easy to join. After completing level 1, the organization can decide whether it wishes to maintain its status at this competency level or continue its progression to competency level 2. The OLRP was designed to reduce barriers to entry and have the capacity to be flexible to support all health or social service organizations in their journey to improve access to care in official languages and adaptability to other languages. The program was designed to enable a realistic time commitment based on organizational priorities and needs. The OLRP empowers health and social service organizations to improve the safety and quality of services, improve access to services in official languages, benefit from alignment with evidence-based guidelines, and demonstrate their commitment to health equity. We are striving for increased language accessibility in health and social services and want to involve you in this journey. The barriers to join the program have been reduced, so it is now easier to join regardless of your readiness state. We would be honored to support you on your OLRP journey as we all strive together for safer care and a healthier world. The Official Languages Recognition Program Discovery Level 1 is now available. Visit the Accreditation Canada website to take the next step on your journey to language accessibility and consult Equity Link for resources, tools, or more support. Thank you.
Wow, that was a very complete and thorough presentation. It was, I'm amazed by the amount of information and tools that are offered through this program, and as well as through Equity Link. The time is now come for you people who are attending today to ask and voice your question if you decide to do so. So you can either raise your hand by using the either the reaction thing at the bottom of your screen, or using the participants and raise your hand, or you can simply write in the chat box your question. And we do have one question from one of the participants. So we will open the microphone of Marilyn. So Marilyn, if you want to voice your question, you can go ahead.
Thank you very much. Having been in the past the Director of Quality at the McGill University Health Centre, and having done accreditations for Accreditation Canada for many years, I think I was a surveyor for about 10 years across Canada, I'm extremely sensitive to the issue of language and communication to ensure the highest possible quality and the greatest safety for the patient. I've also in the past couple of years been very involved in access to language equity for Anglophones in Quebec. And I do not want this to be a political discussion, but at the same time, I'm really concerned how Accreditation Canada is going to deal with language equity and safety in a organization where it's entrenched in the law to deliver services in French. You know, that's a real preoccupation. And I'm not certain anybody has a clear answer on that, but it is something I'm sure you know you're going to have to deal with going forward. Thank you for letting me voice my preoccupation.
And thank you so much for voicing them. I think that's a very good point. It is something that has definitely crossed our minds, and we've also been able to benefit from support from multiple organizations that have also dealt with similar concerns. The Official Languages Recognition Program does it does consider the fact that every province has its own legislative framework, and with that said, it's a given that in each different province there may be different tips or inclinations in terms of how they will use and leverage the standard criteria from this national standard. This is something that then Geneviève may be able to speak to a little bit more as well with her experiences through Equity Link, but it's definitely something that that we are working with at the moment in terms of how we consider our messaging and how we can best help when the legislative framework has some very specific restrictions or constraints.
Thank you, Chantal. And just so to add, just specifically related to Equity Link, our mandate as the project promoter for this national initiative through Société Santé en Français is to increase access to French language services. We know from the past, from our resources and our current users of Equity Link, that some organizations in Quebec do use the resource. So we have had discussions as to whether there were additional adaptations required within the online tool. And so far, the feedback that we've received is that organizations and the managers that were consulting the tool felt comfortable picking and choosing the tools that were adaptable to their context and the legislative framework in Quebec. And didn't require any additional adaptations from our part at this time. This may change in the future, and we are welcome to ongoing discussions to improve the resources that are provided as well for the Anglophone community in Quebec.
Thanks so much for sharing that, Geneviève. And yes, same here. Marilyn, if you have more information or more feedback that you would like to share with us, we're very open to that feedback, and we'd love to hear your thoughts.
Thank you very much.
Thank you very much, Marilyn. And for some of you who might have Francophone colleagues who might be interested to hear today's webinar, but in French, previous webinar was done in French on the Programme de Reconnaissance et Langue Officielle, and you do have the direct link to that recording as well in the chat box. So we thank you for your interest, Marianne. We do have one question from Georges, who is with the Université Laurentienne up there in Ontario. He's asking, is any language can be assessed by the program, or is it only French?
So that's a great question. The criteria within the program can be adapted by organizations to varying language needs. Accreditation Canada's Official Languages Recognition Program provides the award of recognition based on the on-site assessment, which really covers at this time English and French. But organizations have in the past used these tools to adapt for increased access to care in other languages as well. So it is definitely within the organization's reach to do so. Does that answer your question, George? Wonderful. Thank you for asking the question.
Yes, he's saying that the answer is quite exactly what he was looking for. Thank you very much. For those of you who are online, and raised hand from Elise. So we're going to Elise Arsenault in PEI. Elise, if you want to go ahead. Elise?
Okay, thank you very much for the presentation. This is quite exciting because I've been working for French language services in healthcare for probably 25 years. I'm the French language analyst with Health PEI, and we have began the work, and I guess there's interest in two areas around home care services and around long-term care services. So at one point we had compared standards with the ones that, for example, if we looked at home care services, we had sort of compared to see where there would be, you know, the same standards. So try to match that. My question is regarding how do we make sure, because this is available as a process on the side, so people can go within their division and do the work. How do we ensure that, because when the organization goes through the accreditation process, there's actually recommendations that would come out for each of, how do we make sure that the recommendations that move, like I'm talking about level 2, like the next level, how do we make sure that the recommendations or the things that come out are also integrated within the whole improvement process, like linking both? That for me, that is a bit of a concern, because I just want to make sure that it's not a project on the side, that it is fully integrated in practices and stuff like that. So
that's a great question. I'm going to do my best to touch each point you've just brought up here. So how do we make sure that the results of level 2 are integrated into the work that is already being done within the organization? Is that your question? Do I understand correctly?
yeah.
Okay, so that's a great question. There are multiple touch points with our client engagement team at level 2, whereby questions can be answered directly by this person who's helping you throughout the process. When we're looking at the criteria of the program, those criteria, they work on top of everything you're already doing. So you can be working on Cumentum and you already have thresholds that you're looking to meet through Cumentum. But OLRP really is overarching. So you'll see that there is a reduced number of criteria, but they are very specific to the competency of language accessibility. In addition to that, there is support that is provided throughout the process for conducting your self-evaluation at level 1, which will help you with your quality improvement practice plan at level 2. So that's another way that it can help to integrate the process with what you're already doing right now, without necessarily being like an entirely extra project on top of Cumentum. Does that make sense?
Yeah.
Awesome.
Thank you.
Pleasure.
We now have a question from Julie Lessard from Manitoba. Julie?
Salut. Yeah, so Julie from St. Boniface Hospital, L'Hôpital Saint-Boniface. And so we had the privilege of being part of the pilot project. Salut, Geneviève. So my question is more on the logistics side of things. So because we were part of the pilot project, we did receive the final report, and we were evaluated on 5 services within the hospital. So here's my question. Once we register again for level 1 and then go towards level 2, so level 1, so is it registering at the hospital level in general, or do we pick specific services within the hospital that we really want to evaluate and see, you know, where we can do better? And if we do want to do more than one service, then do you have to reapply more than once? Or is it just like the $500 and that'll cover if you want to do women and child, you know, patient reg, like, so that's kind of my question. Level 1, comme ça l'englobe quoi?
That's a great question. So level 1 is at program level per site. The reason for this is because we issue our certificates and our awards on that basis. The certificates that you receive from the program are powerful communication tools that you can use with your patients, clients, and residents. So essentially, the design of the program, which is decentralized, was originally meant to reduce barriers to entry for organizations that are not envisaging that for the entire organization at this time. But if, for example, Hôpital Saint-Boniface would be ready to move forward as an entire site, then it would simply be a question of examining which programs are encompassed in that site, how many sites are included in this scenario, and that would give you an idea of how many self-assessments have to be performed at program level. And again, the self-assessment is fairly short if you look at it compared to many of our other programs and offerings. So it is something that's much more manageable at that type of granular level. It also enables various programs or organizations to see early wins. You know, when they start small, they get to see change that they can then apply to the rest of their organization and use as historical lessons. Now, does that answer your question, or would you have another follow-up question about that?
Yeah, I guess I'm wondering, because at the moment I am using the pilot project report as a tool. So it's like a working document for me already. It's been really nice, especially to connect with directors and managers.
Nice.
But yeah, so I'm wondering, like, so would we restart at a level 1? Or would we continue like on a level 3? Like, I guess because we're part of the pilot project, that kind of means nothing, right? It's just like, we'll have to
It's a
restart
good
at level 1.
question. And it's a very valid question. So the pilot project, when that took place, it started with the on-site assessment, right? Which is what is quite difficult for many organizations to take on as a first step. So that's why, based on the learnings from that pilot project, the program framework was revised to make sure that progression through the program is gradual, which is why we now have a step 1, a level 1, and a level 2. And which is why level 2 is where we do the on-site evaluation.
Mm-hmm.
But one of the key pieces in there is that a self-assessment has to be performed within the latest, 18 months before that on-site survey. Because we need the most recent data to start building, organizations need the most recent data to start building their quality improvement practice plans for level 2.
Okay, yeah, makes sense. Merci.
Avec plaisir.
Merci beaucoup. Thank you very much, Julie, for this question, and congratulations on undertaking this the OLRP program. We do have one question from Christine Coury, which is who is with CHIO. But I would like also to tell people that you will be appearing on your screen a few questions to evaluate today's webinar. So while we continue on with the questions, if you can still just look at the questions and just check the box corresponding to your answers and go all the way down. There are only 4 questions. It would be greatly appreciated. Christine, do you want to go ahead with your question?
Hi, this is not Christine, actually, it's Sheila James, but Christine sent me her link because she couldn't attend. So I'm the director of the Office of Access and Equity at CHIO. And I attended a webinar for Carrefour for the active offer. And that was more around how you deliver the active offer. And this webinar today, this session is more around how you self-assess and get the recognition, right? I just want to be clear about, because
can you repeat the question for me, please? My apologies.
I just, I attended another webinar by Carrefour about the active offer. How do you actually implement the active offer and monitor the active offer? But this webinar today is more specifically about the recognition program, how to apply or sign up for it and how to assess yourself. And I just want to be really clear about the different webinars so that we can share this with our French language committee and ensure that, you know, this is something we want to do.
Okay,
Yeah,
yeah,
maybe I can, yeah,
go ahead,
maybe I can
Nathalie.
just start at the answer and then you can continue on, Chantal. Thank you very much for being with us today and attending the previous webinar. The previous webinar was an introduction to the Carrefour of Offre Active, which presented different tools that are available to you in order to gain more information about active offer and the different resources that are available. Today's webinar is different, and I'll let Chantal continue on with today's.
Yes, well, I was just going to say that they are in fact different. So if you're thinking about what can I share with my colleagues about the official languages recognition program, we definitely do have some slide decks and some informational resources. But as far as active offer goes, that is quite a well-known concept in official language accessibility. So you may see that in other contexts as well. But OLRP is the assessment program that rewards organizations for undertaking that journey.
And if
Thank
I may
you.
add, so as Nathalie mentioned, the Carrefour for active offer is sort of a toolbox of various resources that are available to support active offer in organizations, and they work in conjunction. So Equity Link, similar to the Carrefour, also offers these resources, but in a guided approach. So more of a sort of online training approach to guide organizations. And the Carrefour is one of the tools that we do link off to in the active offer section. And finally, the OLRP is there to help assess the organization's effort and get the recognition for the work that they're doing to offer French language or English language services actively.
Thank you for the clarity. Thanks.
And to an earlier question that was asked, and I forget by who, but just to quickly delve on the client engagement team and how they can assist you at level 2, whether your organization has 1 or 2 or 3 programs or all programs enrolled, the touch point for that organization will be the same. So essentially you have someone following your progress as well on the Accreditation Canada side for support. So I just wanted to add that as an additional piece of info.
Wow, we've had active participants today. We're thrilled that by so many questions from you, and the time is running out. So I would like to thank both our panelists today, Geneviève Laferrière and Chantal Galipeau. As well, I want to thank every one of you who are attending for your active participation and your interest. The recording of this session, today's session, will be on the website. So definitely you can access that. And I just see in the chat that Chantal is also saying that she will share the PowerPoint presentation that you saw today. So this will all be available for you to share with your colleagues by the end of next week. Geneviève Laferrière, Chantal Galipeau, thank you very much for your webinar today. And I hope that you get a whole lot of participants from today. Thank you again, and see you next time.
Thank you so much. Have a great day, everyone.
Thank you.